as I was taking care of patients in the emergency department who were arriving unconscious or with altered mental status, we realized that these people came with very high temperatures. And in addition to that, many of them had taken drugs, methamphetamine or fentanyl. And as we began to see more and more of these patients, realized that this particular problem, which was diagnosed as heat stroke, was more than heat stroke. It was actually a combination of heat from the high temperature and exposure to drugs that they had taken. My name is David Sklar. I'm an emergency physician from Phoenix, Arizona, known as America's hottest city. And I'm going to be talking about an article, Climate, Heat, and the Limits of Medical Diagnostics, Lessons from America's Hottest City, that will appear in the December issue of Mayo Clinic Proceedings. My co-authors are Fred Hafferty and Pope Mosley. We've actually had 3 out of our 4 warmest summers over the last 3 years. So the article that I'm going to talk about is why we should be looking at this problem of heat illness and heat stroke as something different from the way it's been described previously in the medical literature. And the idea that we have is that we should really be looking at this increase in people presenting to emergency departments and hospitals with heat stroke as heat poisoning. Heat poisoning is a combination of high environmental temperature and the use of certain kinds of drugs that will also exacerbate the body temperature, methamphetamine and fentanyl in particular. What we've learned as we looked at this particular problem was that it's a multifaceted problem. It's not necessarily just the environmental heat, which is a problem and getting worse, not only in Phoenix, but all over the country and all over the world. But it's a combination of other issues. The use of drugs, the social situation where people don't actually have a home to go to, so they're living in the street, living in parks. And so when it's very hot, they can't get out of the heat because they don't have the access to a home with air conditioning. And when I talk about heat, I mean really hot, temperatures 115 or higher. When that happens, and then on top of that, they take drugs, which unfortunately is increasingly prevalent among the homeless population, they will collapse and often collapse in a place where nobody sees them. It can be in an alleyway, in a park, and their temperature rises to the point of becoming fatal. In some cases, people see them and 911 arrives and they can be transported to the emergency department. And if that happens, we can cool them off. What we've learned is that if we can cool them off rapidly, we can actually save their life. And so if we can get their temperature, which is often as high as 110 or 112 degrees, if we can get it down to below 104, a fair number of those people will actually walk out of the hospital neurologically intact. When they do arrive in the emergency department, we immediately immerse them in ice water and begin bringing down the temperature. And we can usually do that in about 30 minutes. We can take someone from about 110 or 111 down to about 103 and a half, and then take them out of the ice water. We're actually now using EMS to begin that cooling process by using body bags with ice water to begin the cooling process so that we don't have to wait the 15 or 20 minutes that it would otherwise take for transport to begin the cooling process. A lot of some of the previous literature did not necessarily emphasize the importance of use of ice water. And in fact, it's actually relatively easy to do if you're prepared. We use body bags. You know, it sounds a little brutal to talk about a body bag as a medical treatment, but because they're plastic and they hold water and fluid and so on, they actually are quite appropriate and helpful to immerse someone and still be able to take care of them, because some of these patients will need to be intubated, so they'll have airway problems, or they may need even CPR or other kinds of resuscitative efforts. And the body bag allows access to their head and face and chest and so on. So we are able to do that. One of the things I want to talk about as far as the importance of heat poisoning, which is what we emphasize in this article, is that it really allows us to look at different ways in which we can prevent people from actually ending in the emergency department by attacking the factors that go into the whole problem of heat stroke and heat illness. So what we talk about is that there are behavioral issues, often mental health problems, use of the drugs that I mentioned. There's the social issues where the people are homeless. So clearly, this is a political and policy issue of developing more housing options for people where they can get cooled, or also cooling centers where people can go on really hot days and get out of the heat and get fluid and water and so on, and prevent themselves from becoming a heat stroke victim. And then warning when it is going to be really hot. So we usually know through the weather forecasts when we're going to have extreme heat, and getting that information out to people so they behave appropriately. They don't go hiking. Even though it may start off in the morning, not so hot. If someone goes hiking up a mountain, they may find themselves in a very, very hot environment without having adequate water and become a heat stroke victim. So again, identifying those really, really hot days and being able to protect yourself. Education is also important, educating our other health professionals, EMS, emergency physicians, ICU doctors about the best way to treat people. Primary care doctors have patients who have multiple chronic medical conditions. Those people are at higher risk, working to develop ways in which they can prevent themselves from becoming a victim, and provide ways of identifying when they are getting problems related to the heat wherever they are. And again, although I'm talking about Phoenix as America's hottest cities, this is not just a problem in Phoenix or in other parts of the US or the world that are known to be very hot. Other parts of our country now are experiencing heat waves. And so everyone all over the country needs to be prepared, even places where they don't have much air conditioning. And then also looking at some of the public health issues, because one of the other things that we've realized is that there's a lot we don't know about why some people end up as heat stroke victims. And so if we could develop heat review teams, death from heat review teams, to look at every single person who does die from the heat and what factors could be changed. This is a community problem. It's not just a medical problem, although as health professionals, we will do everything we can to help people survive and not suffer consequences. The best approach is prevention, but prevention really requires a community approach in which we look at all the factors.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.